Hello, I am Dr. Joe Ebner, the Chief Medical Officer at Speare Memorial Hospital. Today is April 23rd, 2021, and this is a COVID-19 update intended for the greater Plymouth community in central New Hampshire. Let's take just a minute to talk about where we've been over the last 14 months. As most of you know, we went into social distancing and masking back in the spring of 2020. The purpose of this was to flatten the curve so that we would not overwhelm our state's hospital system with sick patients from COVID-19. We were extremely successful in flattening that curve. And back in the spring of 2020, in May, we peaked at about less than 120 patients any given day across the state in the hospital with COVID-19. Through the summer and fall, we had relatively low levels of hospitalized patients with COVID-19. We saw a peak, though, after the holidays in January. In January, we saw over 300 patients a day in the hospitals across New Hampshire with COVID. This has progressively fallen through the spring. We were down to less than 75 a day in March. April saw a little peak of about 130, but well within the capacity of your state's healthcare system, and that trend is now continuing downward. This is good news that through our work together, we've been able to flatten the curve and not overwhelm our healthcare system. Currently, there have been over 90,000 positive COVID cases in the state of New Hampshire. The vast majority of these have been mild or asymptomatic. However, about 1,000 of our citizens have died over the last year because of COVID. This represents about a 1% mortality rate. This group is largely the elderly and people with chronic illnesses, putting them at increased risk of death from COVID-19. Locally, in Plymouth, at Speare Hospital, we maintain to have capacity for sick patients. We're running at full operations, providing in-person, as well as telehealth appointments. We are careful to screen all patients and visitors when they come to the hospital, and we encourage masking throughout. And we also pre-test patients for COVID before invasive procedures or surgeries. We have every hope in healthcare that, like other pandemics, this will eventually burn out and become a shared history that we all have. However, it may fizzle but require periodic booster shots. In any event, not knowing exactly how the future will play out, I can say with confidence that we are currently in the vaccine phase of this pandemic. Millions of people around the world since December 2020 have received one of the 3 available vaccines against COVID-19. And because of this, we are seeing across the world where this vaccine is available, decreasing hospitalizations. As most of you now know, the Johnson & Johnson Janssen vaccine has been held for a couple of weeks while medicine takes pause to do some research. This is because roughly 6 women, ages 18 to 48, had a very rare complication after the shot, developing a blood clot in their brains. Considering nearly 7 million people have received this vaccine, this translates to a less than 1 in a million chance of this very rare complication. There is certainly a greater chance of having COVID illness from others, and if you're elderly or have other high-risk conditions, a higher chance of severe COVID or death from the COVID vaccine. However, the medical community is in support of further evaluation and investigation into these cases before we consider opening up the Johnson & Johnson Janssen vaccine again. I anticipate we will hear from the CDC in the upcoming month. So, when will you be considered fully vaccinated? You're considered fully vaccinated against COVID-19 roughly 2 weeks after the final dose. For that Johnson & Johnson Janssen product, it's a one shot. So 2 weeks after that injection, you're considered fully vaccinated. For those of us that may have received the Moderna or the Pfizer shots, it's 2 weeks after that second shot. And as you know, those shots are administered a number of weeks apart. What does it mean when you're fully vaccinated? It means that you can again gather in small groups without masks. It means that there's no testing requirement after or quarantine after domestic travel. However, the CDC still recommends, with international travel or cruise ships, that there's a negative test prior to return trip home, and that you also be checked 3 to 5 days after your return. The CDC does continue to recommend masking in public and to maintain social distancing and to avoid large groups. It is possible later this spring, as more and more of our citizens, both in the state and across the country, get vaccinated, that we will see a loosening of some of these restrictions when it is safe to do so. Vaccines are now available to all people in New Hampshire ages 16 and up, regardless of your residency. On the screen here now, you'll see the address, vaccines.nh.gov. If you go to this site, it'll walk you through the steps to schedule a vaccine. Another option is to dial 211. However, sometimes people experience long delays in using the phone. If you're having any problems or concerns scheduling a vaccine, please reach out to your primary care provider. We're here to assist you in making those vaccine appointments. Coming in the next couple of weeks, I anticipate we will hear an announcement that the COVID-19 vaccine will also be available for children 12 and up. Please look for this announcement in the next month. We anticipate offering this through the healthcare systems and the hospitals of New Hampshire. So just as a review, if you're having any symptoms of COVID, such as fevers or chills, cough, shortness of breath, fatigue or body aches, headache, sore throat, loss of taste or smell, congestion, runny nose, nausea, vomiting, or diarrhea that can't be explained by other things, please consider staying at home and get COVID testing. You can see the address on the screen, spearehospital.com, if you would like to access this to get a COVID testing appointment. The testing for folks with symptoms is an immediate result you'll hear within 15 minutes. If it is a test that's being done for exposure but no symptoms, we get those results back in a couple of days. In addition, if you're diagnosed with COVID-19, you should follow the New Hampshire Department of Health and Human Services guidance on isolation, which basically means staying isolated for 10 days since the COVID symptoms began, and over 24 hours of recovery before coming out of isolation. If you do not have any symptoms, but you've been diagnosed with COVID, the recommendation is to isolate for 10 days from the time of that positive test. In addition to isolating yourself, we do recommend you also contact close contacts, such as household members and other folks you may have been in contact with in the 48 hours prior to your symptoms developing. Your household will need to quarantine for 14 days after that last exposure to you, which often starts after the 10 days of isolation. Although their recommended quarantine is for 14 days, they should be tested 5 to 7 days after the exposure to see if they've converted to positive. When you think about who you may have been exposed to in the previous 48 hours to developing symptoms, you want to think about were there any people that you were within 6 feet of for more than 10 minutes and without masking. We are in this final stretch of this pandemic, which started at the end of 2019. I do not for a minute want to minimize the toll it has taken on thousands of people's lives, on millions of people's livelihoods, and their sense of well-being. I do implore you, along with the rest of the medical community, to get vaccinated and to maintain your diligence in being responsible with mask use and social distancing. We are certainly hoping for a better summer for 2021. And until we talk again, stay well.